All of us are talking at times to our friends about whitening our teeth, getting veneers. Do I have stains on my teeth? How do my teeth look? We're all self-conscious about our smiles. And it's well established that a good smile is good for us in a business sense, a home sense, a personal sense, a social sense. It's good to have a good smile. And there's all kinds of research studies with criminals having bad smiles and having a bad life and having maybe a bad rap. So the bottom line is that it's very important to know a little more about whitening our teeth and what causes staining and what we can do about it. So very briefly, let me tell you that there are some real medical experts on the whitening of the teeth who've gone and done a great deal of study and work on it. Now, are the over-the-counter whiteners okay? If your teeth are perfectly flat and you wanted to use a whitening system and so on that you can buy at the pharmacy, there's no harm in trying it, but you have to first get your teeth really well clean, because any stains or pellicles or plaque on the teeth will mean that whitener will be sporadic result. You won't get a good result. The other thing people ask me about is, can stains be taken off? Well, there's many types of stains, but some are in the tooth and some are exterior to the tooth. So we have to come in and look at them and analyze what type of stain you have, and then analyze what type of whitening system would be best for you. And if you have hypersensitive dentin, it's not good to do whitening because your teeth have become more sensitive. So if you want more information, email us info@dolphindentistry.com or phone us 613 to learn more. Call 234 and 5758, make a smile date.